Live Fit Podcast, episode 132. Heal your bad back with Dr. Harry Adelson.
Function. The way stem cells work is they really have two superhuman powers. One of them is the definition of a stem cell is that they have the ability to either, when they reproduce, when they divide, to either turn into a new version of themselves, which is self-replicate, or they have the ability to differentiate, turn into a target tissue cell. Your bone marrow stem cells actually have the ability to absorb these exosomes into themselves. So now what we're doing is we're supercharging your own bone marrow stem cells with these exosomes from these culture expanded mental cells.
Welcome to the Live Fit Podcast with Glenn Johnson, your resource for all things that contribute to good health. You will hear expert advice and interviews with leading authorities on fitness, food, fat loss, mindset, and the mind-body connection. You will find show notes, articles, and health programs at livefitpodcast.com.
Yes, it is time once again for the Live Fit Podcast. I'm your host, Glenn Johnson, your guide to better health. Thank you, everybody, for listening. Today's guest is Dr. Harry Adelson. He practices regenerative injection therapy, which means he uses a person's own stem cells to grow new tissue in painful, affected, damaged areas. And this can help with back pain and other pain in other joints of the body. It can help people live their life again free of pain and narcotics and maybe even surgeries. Dr. Adelson began his training in regenerative injection therapy in 1998 while in his final year at the National College of Naturopathic Medicine in Portland, Oregon. He opened Docere Clinics in Salt Lake City in 2002, and from day one, he practiced 100% regenerative injection therapies for the treatment of musculoskeletal pain conditions. Since February 2010, Dr. Adelson has performed over 4,000 bone marrow and adipose-derived adult stem cell procedures, placing him among those most experienced in the world with use of autologous stem cells for the treatment of musculoskeletal pain conditions. All right, there's all the technical jargon. Basically, what he does is he takes stem cells out of a person's bone marrow. So they drill a tiny little hole in the pelvic bone, suck out some stem cells, spin it around. He's going to explain all this in a second. I'm just giving you the shortcut. Spin it all around to get just what they want out of it, and then they inject it in the affected area, such as the back that is having some trouble, and it will actually grow back the tissue that has been damaged. Pretty darn cool. Now I'm going to let you hear what Dr. Adelson has to say, how he does his job, and maybe it'll help you. Hello, Dr. Harry Adelson. How are you doing today?
Fantastic. Thank you for asking.
You know, when I was first looking into having you on my show, I was weighing the reasons or the benefits why having you here talking about stem cell therapy would be beneficial to my listeners. And after we talked about it a little bit, it sounds like what you have to do, what you have to say is different than on episode 121 when I had Dr. Joanne Halbrecht on. She was also talking about stem cell therapy, and you explained to me that she works on the peripheral joints. Is that correct?
That's right. She does shoulder, elbow, wrist, hand, hip, knee, ankle, foot, whereas our focus at Docere Clinics is treatment of the spine.
Okay, and is there anything else different about your treatment, the way you process? I mean, what do the listeners want to know about stem cell treatment?
Sure. Well, the focus of our practice, Dr. Halbrecht, who's very well known and very well respected in the industry and is a very good doctor, her focus is on the use of adipose-derived stem cells. You do a small liposuction, a miniature liposuction, we call it a lipoaspiration, and isolate the stem cells from the fat. Although we do that, and we've done that here for a number of years, our focus is really on the use of bone marrow stem cells combined with exosomes. And exosomes really are the most intriguing thing to come along in years in regenerative medicine.
What are exosomes?
So exosomes, so let's go back to cellular biology. So you remember, cellular biology 101, and they put up an image of a cell, and there's the cell membrane, which is the surface of the cell, and then there's the organelles of the cell. And the biggest and most notable of the organelles is the nucleus. And the nucleus is what contains the genetic material, the DNA and the chromosomes and so forth. Then we have the mitochondria, which Dave Asprey loves to talk about mitochondrial function. And then we have the Golgi apparatus. And we have, all these different organelles, which are, the organs of the cell. Well, there's these small little vesicles within the cell that are called exosomes. And in stem cell biology, for many years, we thought the exosomes were the waste products. When I was in school, when I was in naturopathic school back in the 90s, we thought the exosomes were just the excretion of the cell. We thought it was the waste product. Well, in recent years, what we've discovered, with stem cell function, the way stem cells work is they really have two superhuman powers. One of them is, the definition of a stem cell is that they have the ability to either, when they reproduce, when they divide, to either turn into a new version of themselves, which is self-replicate, or they have the ability to differentiate, turn into a target tissue cell. And we always used to think that that was really the mechanism of action of stem cell therapy, that we put these stem cells in the area of damage and they turn into the target tissue cell. And what we found out is actually that's really an oversimplified version of what happens. It's actually the second superhuman power of the stem cell, which is called the paracrine effect. The word paracrine means intercellular communication. So this is the stem cell's ability to recognize the environment that they're in. They're able to recognize if they are in the presence of damaged or dead cells. If they are, in fact, in the presence, so that's receiving information. So they're able to receive this information that they are in the presence of damaged tissue. But then they're able to communicate back. They're able to give information, which is in the form of releasing these exosomes. Turns out these exosomes are filled with communicating molecules. These are the exact growth factors and communication molecules that trigger the growth of new cells, the repair of cells. These are the communicating molecules that kill invading microbes. They control inflammation. This is when stem cells actually are able to trigger the healing process. This is, in fact, these are how it happens. This is the currency of stem cells. So the exosomes that we use therapeutically and clinically is there's a laboratory in New Jersey. They're called Chimera Labs, and I work very closely with them and with their scientific director, Dr. Doug Spiel. So what they do is they take placental stem cells. So they recruit these women who are scheduled to undergo normal births. They screen them for every imaginable communicable disease. If they pass that screening, the woman then gives birth to the baby, and the Chimera Labs has a rep present at the birth. They take possession of the placenta. Placentas are filled with the most robust stem cells. So they take these stem cells and they then expand these stem cells. So they grow hundreds of millions of these stem cells. They then do something very interesting. They put these stem cells in a stressful culture medium. So what that means is they trick the stem cells into thinking that their host is under duress. So they sprout these vesicles filled with growth factors. They're preparing for lean times. And these are exosomes. These vesicles filled with growth factors are called exosomes. But then they do something very interesting. They destroy the stem cell and just harvest the exosomes. So you're now discarding the other person's genetic material and just taking the active ingredient. So now all the concerns that one might have about taking somebody else's DNA into your body, if you're using whole stem cells from placenta or from umbilical cord or anything from someone else, these now get washed away because we're discarding the nucleus and we're only harvesting the exosomes. And as our own stem cells age and function suboptimally, the reason they function suboptimally is we lose the ability to produce these exosomes. Because these exosomes are don't contain genetic material, when we combine them with your own bone marrow stem cells, your bone marrow stem cells actually have the ability to absorb these exosomes into themselves. So now what we're doing is we're supercharging your own bone marrow stem cells with these exosomes from these culture expanded dental cells.
Holy mackerel, that is a lot to take in. I had some questions from the beginning, a dumb joke, and then some more. So I was taking a few notes, but mostly I was really listening.
Well, what are your questions? Let's shoot.
Well, first I was going to make a dumb joke about exosomes sounding like a Marvel superhero that's going to be on the next Avengers movie. And then you started talking about it as if it actually is the superhero of the cell. And I wanted some clarification of stem cells themselves, because many years ago there was all kinds of media coverage of this controversy about stem cells and the right to life. People were against stem cell research and other people wanted to do it because there would be great scientific advances in it. So what is the deal with stem cells being against the right to life?
Okay, so let's back way up. So what it is that we do at Docere Clinics and what it is that we're talking about is primarily autologous. So these are like when we're talking about bone marrow stem cells, these are stem cells from your own body. When we're talking about these placental cells, these are stem cells from a placenta. So a woman has given birth to a baby, the baby's perfectly healthy, nothing happens to the baby, the laboratory takes possession of the placenta only, which is going to go in the trash otherwise. So let's just differentiate. Now, what all the controversy was about was originally, the original stem cell research, mostly starting back in the 80s, was around embryonic stem cells. And, you can argue that an embryo is in fact a human life. But let's take that a step further back, because the embryos that are used, the spin that is frequently used is that these are aborted babies, which is completely untrue. It is very far from the truth. So when we're talking about embryonic stem cell research, let's talk about the embryos that actually are used. So when a scientist uses an embryo, where you get the embryo is from an in vitro fertilization laboratory. So in vitro fertilization, the area of fertility medicine is when you have a woman who's having difficulty conceiving. So what she does is she goes to a fertility clinic, also called in vitro fertilization laboratory. So the woman, the fertilization doctor will give the woman a medication so that she sprouts a bunch of eggs at the same time. The surgeon then removes these eggs, surgically removes the eggs, puts them in a petri dish. They then put sperm in the petri dish, and in vitro means in glass, like in a test tube. So in vitro fertilization means the fertilization is occurring in a test tube. So we actually fertilize these eggs in the test tube. What then happens is the surgeon looks at these embryos, because he's creating embryos in a test tube, and picks out maybe the 8 best looking ones, the ones that look the healthiest. Those get implanted back into the woman, and hopefully, they take. And that's what in vitro fertilization, that's what, when you go to a fertility clinic, that's what's happening. Well, now you have these leftover embryos that didn't get used. Those go in a freezer until kingdom come. Those go into a freezer forever. They just get placed in a freezer and parked until the end of the world. When we talk about embryonic stem cells, those are the stem cells that get used. So those are embryos that will never get used for any reason. They're going to go in a freezer forever. There's two options. That's one option. The other option is they get used medicinally. They get used for stem cell research. So all the controversy is about those. It's not about
an embryo.
Aborted babies.
Okay.
Correct.
And of course, so is it embryos or eggs?
No, it's embryos. So let's get our terminology straight. You have an egg and you have a sperm.
And those it was fertilized.
The egg is from an ovary. The sperm is from the testicle. You put an egg and an ovary together, and they fertilize. You grow 8 cells, a ball of 8 cells, and that's an embryo.
Gotcha. So it could become a baby under the right circumstances or not. And of course,
right, but those particular ones will never become a baby because those are the leftovers. Those are the rejects from the in vitro fertilization lab.
Right. And why are they saved forever?
Because to destroy them would be, because you can construe them as human life.
Okay, I gotcha.
You can't destroy it's the same argument. So really, if you're going to be against use of embryonic stem cells, you really should be against in vitro fertilization because you're creating embryos that will be wasted.
So if you start upstream a little bit farther with your soapbox, ideas of what's, the difference between right and wrong, you should really start at the source, not at, a few steps down.
I think so.
You are listening to the Live Fit podcast with Dr. Harry Adelson of Docere Clinics. He's telling us how he heals damaged joints without surgery. Let's get back to the Live Fit podcast with Dr. Adelson. Dr. Harry, tell me what you can do with your stem cells. Why is what you do helping mankind?
Well, this whole conversation about the embryonic stem cells, what we discovered sort of later on was that, the reason there was so much focus on the embryonic was because early on it was scientists PhD types who were figuring out what could be done with stem cells. Well, once clinicians got involved and they said, we can just get stem cells from bone marrow. Like, we don't need to go raid the in vitro fertilization freezer to get these embryos. Let's just take it from the bone marrow. And in fact, when you're treating musculoskeletal pain, which is the focus of my practice, you're actually better off with, so you imagine the stem cell family tree. You have at the top of the family tree, you have the embryonic stem cell, which is the most primitive, of the stem cells. And you kind of come down the family tree and you come down a couple of levels as they start to differentiate into different cell types, and you get to the mesenchymal stem cell, which is what it is that you find in bone marrow. And that actually is preferable when you're treating musculoskeletal pain. You would rather have a mesenchymal stem cell because it's further along the trail. It's further down the family tree. It's closer to what your target tissue is. Your target tissue is going to be ligament, tendon, cartilage, bone. It's going to be, working on tissues that are involved with musculoskeletal pain. So the focus of our practice is the treatment of chronic musculoskeletal pain conditions. And, I'd like to point out that, like low back pain, for instance, which is a big part of what we do, might not sound as sexy as treating cancer or perhaps heart disease. But, let me point out that low back pain is the leading cause of disability worldwide. The economic impact of low back pain is greater than cancer and heart disease combined. So even though low back pain doesn't kill you, it has devastating impact on the global economy, and it has devastating impact on people's quality of lives. If you're unable to contribute in the form of work, if you're unable to, if your life purpose in any way involves the use of your body, and you're unable to use your body because you've got debilitating low back pain, that is a very real, serious problem.
Yeah, it sure is. And speaking as a person with chronic lower back pain, this sounds pretty attractive to me because I am and have been up until the last few years a very active and fit person. I'm still active and fit, but I really have to curtail what I can do to not exacerbate my back pain and then be laid up for a few days, which is a drag because I like doing stuff. I like building stuff. I like climbing and crawling and all that. And I really have to be careful. And I've caught myself moving like an old man, which I don't want to look like that at 50.
Yeah, Glenn, so let me ask you, so is your low back pain right smack in the center, dead midline, right about at or slightly below belt line?
Yes, right about belt line and to the right side.
Yeah, and if you were to, and when you're having a flare up, when your back pain is bothering you, if you were to hold something out in front of you, like a 20-pound object, and hold it out in front of you and lean slightly forward, would that make it worse?
Yes.
Yeah, so you have a dehydrated disc, and that is, when I talk to young, healthy people who are physically active with midline pain, worse bending forward, it's called a desiccated disc, a dehydrated disc. It's incredibly common in weightlifters, and the most common, the most common cause of it is deadlifting with poor form. And I think CrossFit is great. CrossFit is really neat. But there's one exercise in CrossFit where you alternate box jumping with deadlifts. Oh. That exercise paid for the down. Yeah, that paid for the down payment of my house. That is, really a recipe for disaster because, with your lower lumbar discs, they're the cushion between the vertebral bodies. But if you are doing that, one of that deadlift motion, and you do it with poor form, it's very easy to, the classic expression is slip a disc, and that's pretty much exactly what's happening. Is you have this shearing action on the intervertebral disc. You split the surface of the disc, the membrane of the disc, and the hydration leaks out. And if you were to look at your back under an MRI, my guess is if we were to look at your back, and we look at your lumbar discs, the one up tops are going to be white, and then we're going to get to the affected ones, and it's going to be black. It's going to be dehydrated. The only conventional treatment for desiccated disc, for dehydrated disc, is fusion. And fusion sucks. I mean, fusion is a bad option. It's one thing if you're like 70 or 75 years old and not active at all. But when you're a young, healthy person, fusion is not a good option because once you fuse one level, it increases the forces generated, the levels above and below, 100 times. And you're going to wear out those discs above and below in 5 years. And you're going to require another fusion in 5 years. 5 years later, you're going to require another fusion.
Yeah, and I really don't want to go that route. That would really interfere with my cat-cow move when I do yoga.
Yeah, that's exactly right. And that is, I would say at my clinic, the thing that, it is probably my favorite thing to treat is desiccated disc. Not so much, because, I do very well treating knee pain. We do, with people who have arthritic knees, we do very well, we have good success with that. But, worst case scenario, you can get a knee replacement. And, I wouldn't want to get a knee replacement, but, that is an option.
But you can.
But with desiccated disc, there's no good option. There's no good surgical option because fusion is not a good surgical option. But that is I would say the number one thing that I love treating is desiccated discs, injecting bone marrow stem cells combined with exosomes directly into the intervertebral disc under X-ray guidance.
All right, that answers one of my questions because it sounded to me before that I probably misunderstood what you're saying, that you would inject into the bone marrow and that would make the regenerative components that would then go to the injured area.
We're harvesting this. We're taking stem cells from the bone marrow. We're taking, the big flat bone in your hip that is called your ilium. You have your pelvis, and you have those big frisbee-shaped bones in your hip. Those bones are rich with stem cells, and it's kind of like your bank account. You have these stem cells that live in there that are laying dormant mostly. So what we do is we just take a little money out of the bank, take those stem cells from your bone marrow, we supercharge them with exosomes, and then we inject them directly into your affected lumbar intervertebral discs.
That's awesome. How long would it take? So let's say you did this procedure on me. And by the way, what you're saying sounds exactly right with my diagnosis. I've seen my X-rays, and I've seen many doctors about it, and you're pretty much spot on with what the issue is. So if I was to go through this procedure, would it be, let's see, would I visit you twice? And if so, how long till I started feeling better?
Sure. So what we would do is we do a phone consult because we have so many people who travel from all over the world, really, that we do our initial consult by phone, just so I get to hear the story. And then I get to, I would have you fill out some simple forms, and I'd, look over those, and I'd look at your MRI, and then we'd make a plan. Then people come in, they fly in. We're in Park City, Utah, which is 25-minute drive from the Salt Lake City airport. It's gorgeous. I'm looking out my window here at the Deer Valley Mountain Resort, and people come in the day before, spend the night. They don't eat that morning because we're going to have our anesthesiologist put you to sleep. It's much more friendly experience to sleep through the whole thing. You really don't want to be awake for this. I mean, it does involve a bone marrow aspiration and a poke in the most painful part of your body. So you go to sleep, you wake up 2 hours later, and we're done. People, they're a little bit sore afterwards, but you're already sore. It's nothing worse than a bad day for you. People spend at least one night afterwards. 2 nights is better, and then they go home. The thing about it is that people need to keep in mind is this is the opposite of a steroid injection. A steroid injection, if it's done properly and it's indicated, it works right away. And then if you're lucky, it lasts 2 months and then it wears completely off.
Right.
This is the opposite. The goal of this therapy is we're growing new connective tissue. We're launching the growth of new, healthy connective tissue. And that takes time. So we do the injection, and usually people feel about the same afterwards, maybe even slightly worse because we've been poking around in there. And they're kind of back where they were, and they think, wow, that was a complete waste of time. Yeah. And then at about 2 months, that's when they start to notice the improvement. And between month 2 and month 6, every day they notice they're just feeling a little bit better. And then at about 6 months, that's usually where people plateau. Although I've had people tell me up to a year afterwards they continue to notice improvement. At about the 1 year mark, we check back in. The majority of people that I help, the majority of people that I treat are happy. They've had improvement, and I don't mean 100% improvement, but enough improvement that they're glad they did it and they don't feel like they need to do it again. Well, then we wait. Probably I'm going to hear from that person in 3, 4, hopefully 5 or 6 years. This treatment turns back the hands of time, but it doesn't stop the hands of time. And this is always going to be your weak link. So I expect to probably hear back from you in 5 years. Second category of person, we get to the 1 year mark, and they've had some improvement, but they'd like a little more. So we talk about doing a second treatment. The third category of person is the smallest. That's about 1 in 10 people. I just don't help. We don't help everyone. There's about a 10% non-responder rate.
So my question is, taking my scenario once again, you would take stem cells directly out of my ilium, my pelvic bone, and then put them. So you're using a needle, I presume, and just doing you're sucking them out and then sticking it directly into the disc, or is there some sort of process in between?
There's a very simple process just of centrifugation. So we take the bone marrow out, we put it in a centrifuge, we put it in a specialized container first, then put it in a centrifuge. Then this container separates out what we call the buffy coat. So once it's been through the centrifuge, the red blood cells all go to the bottom because they're the heaviest. The serum all goes to the top because it's the lightest. And in the middle are the stem cells and the platelets. So we draw off this layer that's this hyper-concentrated platelets and stem cells, add the exosomes to that, and then inject that into the disc. We do an epidural injection as well because a lot of people who have disc pathology also have pathology within the spinal canal. And then we do, in the same encounter, the facet joints the iliolumbar ligament, the SI ligament. So we're basically injecting all the moving parts of the low back so as to leave no stone unturned.
Wow, that's amazing.
We've done thousands of these.
Does insurance cover this?
Unfortunately, no. This is considered completely experimental. Insurance does not cover it. And quite honestly, I don't think they ever will. It just does not fit into that model at all.
Why not?
Well, I mean, that's the topic for a long conversation, but I don't think there's enough money to be made by anybody. It just doesn't fit. There's the medical model is really very difficult to alter the direction of, and conventional medicine is very resistant to innovations, and that's because medicine is naturally a risk-averse culture, which is primarily a good thing, but it also can be used it can be used for wrong as well. There's shrinking margins in medicine, which makes people even more resistant to take on new things. There's a tremendous amount of sunk costs. There's spine fusion is a big industry. Spinal surgery is a big industry. Knee replacement, hip replacement, these are massive industries. Anything that could potentially disrupt the system as it is frowned upon and looked upon with tremendous suspect. And anything that is not currently covered by insurance, it's very difficult to get it accepted because, this is additional cost. When I was speaking at the Dave Asprey's Bulletproof Conference, I posed a question where I said, if you had a little bit of knee pain and you knew insurance would cover for it, how many people would run out this year and get a knee replacement? And nobody raised their hand. And then I said, well, if you had a little bit of knee pain and you knew insurance would cover it, how many people would run out and get stem cell therapy? And every single hand in the place went up. I think it would be very difficult for stem cell therapy to be covered by insurance. And maybe I'm wrong, but I think if it is, it's going to be a long time coming, and there'll be a tremendous amount of stipulation around it.
Some insurance companies will pay for chiropractic adjustments, not all, but that was considered, fringe or experimental for quite a long time, even though it's been around for I don't know the history of it, but chiropractic treatments have been around for a very long time. So perhaps I see there's hope that this will eventually be mainstream, because it certainly sounds like a far better way of living than A, putting up with the pain, or B, having some ridiculous surgery on your back every 5 years that eventually makes you immobile at all. So I
agree with you.
I really value what you're doing. I think it's fantastic. I hope it catches on. And I was curious, since it's not covered by insurance, what does this cost a person? So take my situation, for example. Can you give us an estimation?
Sure. So what I'm in the process of doing is trying to create sort of an alternate treatment that will be far more affordable, because currently it is pretty expensive to do what it is we're talking about doing with you, which is really, it's quite complex. There's very few places that do it. My cost is very high. So to treat an intervertebral disc is, depending on how complex the case is, depending on if we're using bone marrow versus bone marrow with exosomes versus bone marrow with exosomes and adipose-derived stem cells, how many levels we're doing, the range is going to be anywhere from $9,000 to $20,000. And there's a bunch of different menu options within there, and it really just sort of depends which route we go. I'm in the process of trying to create a model where we will treat simple things like knee arthritis, hip arthritis, at about 30% the industry standard, where we could do a bone marrow aspiration, bone marrow treatment of a knee, for instance, at around $3,000. And in that model, we'll actually have a tithing model built within that, where 10% of the treatments that we perform will be done not at no charge, not for free, but instead in exchange for documentation of community service hours. So if somebody has an arthritic knee and they don't have $3,000 to have it treated, if you do 60 hours of community service and you can document that you've done 60 hours of community service, that will purchase a stem cell treatment of the knee.
Wow, that's fantastic. So, Dr. Harry, how can people get a hold of you if they want to learn more and possibly have some of your treatment?
Sure. Our website is Docere Clinics, Docere, Docere Clinics, .com, plural, docereclinics.com. And have a look, see what you think, read it over, and reach out to us.
All right. I will, of course, have a link to your website and more information on my show notes page at livefitpodcast.com. I thank you tremendously, Dr. Harry Adelson, for sharing this information with us about stem cell treatment and how it can help people eliminate the cause of their pain. I think it's wonderful.
Sure. Yeah, Glenn. Well, it sounds like you probably need to get treated, so we should get you in here and then record another episode when you're 1 year out from your treatment.
Yeah, I would love to do that. That'd be great.
Super. Well, thank you so much for having me on the show.
Yes, my pleasure. You have a good one.
Thank you for listening to this episode of the Live Fit Podcast.